Madam President, I come to the floor today, as I do week after week since the health care law was passed, to give a doctor's second opinion about the health care law that I believe is bad for patients, bad for the providers, the nurses and the doctors who take care of those patients, and terrible for the American taxpayers. And I come to the floor today reminding myself of and the Senate of some promises that the President made during the health care debate. The President had a couple of key promises. The first was he stated that health insurance premiums would go down. Second promise he made is he said that if you like your insurance plan, you can keep your insurance plan. Now, the President actually reiterated the second point after the Supreme Court issued its decision regarding the health care law a few weeks ago. From the East Room of the White House, the President proclaimed, and I'll quote, "If you're one of the 250 million Americans who already have health insurance," he said, "you will keep your health insurance." Madam President, perhaps the President does not know that his health care law has already forced many colleges and universities to stop offering their student health plans. Or perhaps the President is unaware that you can no longer purchase a child-only health insurance policy in many states, including my home state of Wyoming. Apparently, the President has not spoken to businesses across the country who must actually deal with the ramifications of his health care law. Well, I speak with business owners around Wyoming every weekend as I travel around the state, and the people that I speak with, well, they believe that the law will increase the cost of their insurance, increase the cost of their care, and make it more difficult for them to provide insurance for their employers and for their employees. Now we have a new study, a report that has come out from the consulting firm Deloitte, and it's spoken to businesses all across the country about the law. Their results were compiled in their 2012 survey of employers. In this report, the company did random surveys of 560 companies with 50 or more employees. And these are only of companies that currently offer health insurance to their employees. So, what are the results? Well, the results are not encouraging. They found approximately 1 in 10 employers are considering dropping the health coverage that they currently supply to the employees and dropping that insurance over the next few years. Specifically, they found that 9% of companies expect to drop their insurance coverage, while another 10% of respondents said they weren't sure about how they would proceed. The survey revealed that small businesses, those with between 50 and 100 workers, are going to be hit especially hard by this new health care law. 13% of these businesses in this category stated that they would drop their insurance coverage in the next 1 to 3 years. The next 1 to 3 years, 13% of all of those small businesses between 50 and 100 employees plan to drop their insurance 1 to 3 years. So now keep in mind that the nonpartisan Congressional Budget Office, when they did some evaluations, they thought that only 7% of workers would lose their employer-provided health insurance starting in 2014 because of the law. Of course, the President, looking straight into the camera, straight from the White House, said, if you like what you have, you can keep it. Companies also made it clear that how implementation of the health care law moves forward would impact their decisions. Well, how so? Well, let's take an example. Approximately 1/3 of the companies stated that they might decide to stop offering health insurance if they find that the law that was passed by the Democrats in this Senate, in this body, partisan lines. So if these companies find that the health insurance under the law, required by the law, if they have to offer more generous benefits that they currently provide, they are likely 1/3 to discontinue providing health insurance. Now, why is that? Well, it's because the President's health care law actually mandates what kind of insurance companies must give to their employees. This is what's called the Essential Health Benefits Package, or as most Americans refer to it as government-approved insurance. May not be the insurance you want, may not be the insurance you like, may not be the insurance you need, may not be the insurance that you can afford, no matter how you look at it, the President and those who supported this law say they know better than the American consumers, the American workers, and the people in need of insurance. So instead of allowing businesses and workers to decide what kind of insurance they need, the health care law empowers federal bureaucrats to make this decision. Now, in an article that recently appeared in the Wall Street Journal, the chief financial officer of McDonald's said that he thought that implementing the health care law could cost his company more than $400 million a year. So businesses that decide they can't afford to offer this government-approved insurance are going to be forced to pay a penalty. So how big is the penalty? I mean, it's a legitimate question. The Supreme Court says it's a tax. A tax. So they're going to have to pay a tax. So for companies with over 50 employees, they will have to pay starting at $2,000 per worker. Well, that sounds like a lot of money. But keep this in mind. In 2011, the Kaiser Family Foundation found that the average cost of employer-provided health insurance for families was over $15,000. So they can decide, do they pay the government $2,000, that tax, or do they pay $15,000 for the insurance? This means many companies would have a sizable financial incentive to simply drop the insurance. So then what happens? What happens to these folks that previously had the insurance that the President said they could keep? Of course, we all know that they can't, because once again, the President misled the American people, I believe intentionally. Well, then these employees who were dropped would have to enroll in a government-run exchange. So what happens in the exchange? Well, many of these individuals would qualify for subsidies from the federal government to help them purchase insurance. Subsidies from the federal government to help them pay for insurance that they were previously getting at work, but now because of the health care law, they can't get there anymore. So who's going to end up subsidizing this? Well, the American taxpayers are now going to be paying for the health insurance instead of the employer. Now, this is not only going to cause many Americans to lose their health insurance, but it will also make the $1 trillion health care law even more expensive than the Congressional Budget Office said this past week. Many businesses surveyed stated that they do not intend on dumping the health insurance plans, but they said something else. So we're not going to stop providing it, but instead, employers are saying that, hey, the workers, if you want to keep this, you're going to have to pick up additional costs of your insurance coverage, and you're going to have to do it through helping to pay higher copays, higher deductibles, or participating in contributing to the higher premiums that they're going to have to pay. So for those Americans lucky enough to keep their employer-provided coverage, they will be now paying more money for that privilege. This means employees have essentially two alternatives under this health care law. Either they will lose their employer-provided coverage, or they will be facing higher insurance premiums. For over 150 million Americans who receive their insurance through their employer, neither of these choices is a good one. It didn't have to be this way. And that's why I remain committed to repealing the President's health care law and replacing it with patient-centered reforms that will allow patients to get the care they need from a doctor that they choose at lower cost. Thank you, Madam President. I yield the floor.